So why don't we get started? Thank you for being here today for the release of the rates and for the plans that will be sold beginning October 1 on the MNsure new marketplace, Minnesota's health insurance marketplace for Minnesotans. My name is Mike Rothman, and I'm the Commerce Commissioner for the state of Minnesota. I'm here today with good news for Minnesota consumers. The Minnesota Department of Commerce Insurance Division, along with the Department of Health, Commissioner Ellinger and I are here. We're charged with reviewing all the rates and forms for health insurance for Minnesota's marketplace. And in this case, all the new plans that will be available specifically for MNsure, the exchange. Before I explain the rates in more detail, I'd like to take just an opportunity to thank all of the individuals who have worked on this project, the Minnesota Insurance Exchange, the skills, the time, the energy, my staff, and the folks who help put all these products available and that will be sold in the marketplace. On behalf of the governor and the administration, let me thank those folks who worked on the Minnesota Insurance Exchange Task Force over the last couple of years, including Dr. Ellinger and Commissioner Jessen and myself. I want to thank the hardworking staff at MNsure who have been working diligently 24/7, very hard to build the exchange for Minnesota. I want to also thank MNsure's board members. I also want to thank Representative Atkins and Senator Laurie, the champions of the legislation last year to create MNsure, the exchange for Minnesotans. And I also want to thank, in particular, my staff at the Department of Commerce. Credit goes to a lot of folks, including my deputy, Tim Vandehey, the Division of Insurance Chief, as well as Julia Phillips. Julia is our Chief Actuary and considered among the top actuaries in the country. It also includes a staff of 20 individual members who have been working on the approval of these products to get them ready for today in the marketplace. Now, I'm truly proud of the Department of Commerce, but I also want to thank and acknowledge all of the great work that goes into putting all this together, including the hard work of the Minnesota health plan companies. That's Blue Cross Blue Shield of Minnesota, Health Partners, Medica, Preferred One, and UCare. The success of the final product reflects the commitment of all parties involved, including Minnesota's nonprofit health insurance companies who have supported health reform since the early stages. I also particularly want to thank Julie Bruner, the head of Minnesota's nonprofit health insurance association. She has worked very hard along with all of us. On May 24th, the date when we expected the filings to come into the Department of Commerce, we had well over 400 filings. It included not only the ones that we're announcing today, but others that we'll be announcing October 1. It includes both rates and policies for the open enrollment period that starts on October 1 for MNsure and the traditional marketplace, as you all know. We are also very pleased to be here today. I also want to thank, in addition to those that I already mentioned, Minnesota's healthcare system, all the providers, all of the folks in Minnesota that deliver the quality care to all of us in Minnesota. All of us together, the hard work and attention to detail has resulted in what I, again, had indicated is good news for Minnesota consumers. So let me delve then into and give you a high-level picture of what we are announcing today. I can't say this enough. I'm pleased to share that Minnesota has some of the best rates. In fact, Minnesota today has the lowest average health insurance rates in the country in all of the metal levels in the individual marketplace on the exchange. So if you take a look at the chart, we have Minnesota over here, and all the metal levels And in comparison to the rest of the states that have state-based exchanges that have announced the rates to date, Minnesota's got the lowest average rate compared to those states that have already announced their rates. And that's again at a comparison of all levels, bronze, silver, gold, and platinum rates. What does this mean? And we'll get into a little bit more detail, but Minnesota consumers can or will be able to purchase on MNsure a policy as low as $90.59 per month. And you can see from this graph that these average rates are very competitive. They're less than other states that have already released their rates. Now, why is this good and why is this good news for Minnesota? We have to say and acknowledge that it's Minnesota's long history in health reform, including reform on the rate review process. It's a large contributor to these low rates. Overall, Minnesota has focused on health reform throughout, and as many people know, and throughout as many as possible for all Minnesotans. Minnesota was looked at as a model for many of the reforms that passed in the ACA, including the medical loss ratio. Minnesota was 20 years ahead of the curve in its reforms that we believe have contributed to our ability to announce today these successful rates. This has kept our premium rates down in comparison to other states, and all for the benefit of Minnesota consumers. Additionally, our rate review process has been recognized by the federal government as a state with an effective rate review program, meaning that our rates are studied by extremely experienced actuaries to ensure that the rates that are requested are justified and reasonable. We are one of 31 states in the United States that can deny requested rates based upon whether the rates are justified or not, which does occur after the department actuaries conduct statistical analysis. We look at the trends, the benefits, other assumptions for the health insurance companies and what they're using to determine their rates. The process makes sure that the rates that the consumers pay reflect the value of the plans that they are purchasing. And as I said, in this case, I think, as you can see, the rates speak for themselves. Specifically, we believe that Minnesotans, with these rates that we're announcing today, undeniably are extremely competitive. Minnesotans can no longer be denied health insurance coverage because of pre-existing conditions. Today, rates can only be determined by 3 factors: age, where you live, and whether or not you smoke. So how does this translate into the price of the products? In the St. Paul, Minneapolis metropolitan area, rates will start at $90.59. And that's for a bronze plan purchased by a 25-year-old individual. For a 40-year-old person, it'll be $115.32. And then for a 60-year-old, it's $244.89. We have terrific prices, and these are the starting points. And let me say in bold and highlight that these are the rates for the coverages for these premiums. It does not include the financial assistance available on MNsure that people will be eligible for and be able to check. So these are just the base rates, and then on top of that, Minnesota consumers can check MNsure, and we have April here and Brian Budner from the board to explain how, even after these rates come out, there'll be additional financial assistance. There's other good news on top of all of this, and that includes the fact that Minnesotans will have broad coverage throughout the state of Minnesota. Oh, no, no. Okay. So, in addition to the price, the products on MNsure will cover Minnesota border to border. Minnesotans will have at least 2 companies in every area throughout the state to choose from, and up to 5. So up to 2 to 5 companies throughout the state of Minnesota. We have 5 companies that will be selling plans on MNsure. They are, as I mentioned earlier, Blue Cross, Group Health, Medica, Preferred One, and UCare. There are 141 plans that will be available on MNsure, specific actual products, 78 plans in the individual marketplace, and 63 plans in the small group market. And the great news for Minnesota is that MNsure will cover Minnesota border to border. Consumers in 85% of Minnesota counties have 3 or more health insurance companies to choose from. People in 75% of Minnesota counties have 4 or more companies to choose from. And again, nobody has less than 2 companies that will compete for Minnesota consumers' businesses. We also, to show you the value of these products, have done another comparison with other states. MNsure's overall low rates tell a wonderful story for Minnesotans, but when you truly look at the value the rates provide to consumers, another great story emerges. All of the new plans on MNsure and available in open enrollment have expanded benefit sets like free preventative care. But specific to our state, Minnesotans have the choice to purchase bronze, silver, or gold plans for less than the average bronze plan available across the country in those state exchanges that were already announced. So again, if you look, we have the states here, and these are the bronze prices for the rest of the states. And in comparison, Minnesota's bronze, you can see, is less. Even our silver plan is less than the bronze level plans in other states. And the gold plan comes in very strong. So for Minnesotans and our consumers, they will have a choice to look at their overall health needs. They can assess what they can afford and whether a bronze plan with a higher deductible or but lower premium is best. They can also go to the silver plans and know that they will get a very good price for their premium dollars. Or spending a little more monthly in premium costs to have lower deductible and a less overall out-of-pocket costs. There will be a lot of choices for everyone to choose the best product for themselves. Now, we also have another comparison with other states that is helpful to put everything into perspective. This is showing, and it's all for 40-year-old non-smoker. And what we've done is shown the cost difference between the plans and metal levels on MNsure, and that it's small in comparison to other states. So in addition to the overall low average cost, the difference between the lowest cost plan and the highest is much less in Minnesota than in other states. Well, what does this mean? I'll give you an example. So if you look at Minnesota's bronze level here, and you take the difference between the lowest price and the highest price, the difference is about $53. So that means, and you can see that the range is relatively small here, and that in comparison to the rest of the country, Minnesota's range is relatively narrow. So what does it mean for Minnesota consumers? It means that whether you're purchasing in the bronze, the silver, or other categories, you will have a narrow range and low-cost prices, a low-cost range of prices for options of whether you want a higher deductible or better benefits or a different network, or even, as I indicated before, different companies to choose from. And again, that's up between 2 and 5 companies. I'd like to explain and show a little bit here that in comparison, for example, where in Colorado, their bronze plan can differ in price of up to $155, which is 3 times higher than Minnesota. Or New York, where the average bronze plan from the company with the lowest rate is $308, and the company with the most expensive is $548, a $240 difference. And as you can see, Minnesota is much less than that. But I don't want to stop there. We took a look at even Oregon. And in Oregon, they have more than a $100 difference, which is 2 times higher than our range in Minnesota. So keeping our rates competitively priced and close together provide real choice for Minnesotans. All plans are truly in play. Any way you look at it, the plans and rates that the Department of Commerce approved with Department of Health for MNsure offer many choices for consumers, networks, benefits, monthly premium costs, and deductibles, all to give Minnesota options to choose the health coverage that fits their financial needs, and overall great products for Minnesota. With that, I want to thank you again for being here. I know Dr. Ellinger, Commissioner Ellinger, has a few words to say, and then April will have a few words, and then Brian, and then we'll come back to questions.
Good afternoon. I'm Ed Ellinger, Commissioner of Health, the Minnesota Department of Health, and thanks to Commissioner Rothman for leading us off. This truly is a good day. I would want to add my thanks to all of the people who've been involved with that, our partners certainly in the Department of Commerce and in MNsure and MMB and Department of Human Services that we've worked with on getting the exchange up and running, and particularly thanks to the staff at MDH who've been involved in this. It is good news that we heard already today, and I think this is going to be good news for the state of Minnesota as we move forward. Last week, the Kaiser Family Foundation released the results of a poll showing that Americans throughout the country really have uncertainty about health care reform, understanding what it is and how it's functioning. Nearly half of those polled said that they didn't know how the exchanges and health reform would impact their own families. The poll also showed that many Americans are actively seeking more information about healthcare reform and trying to use that information for decision making. And finally, the poll showed that many Americans, particularly younger Americans, see federal and state agencies as trustworthy sources of information. So these poll numbers underscore the value of what we're doing here today. Starting on October 1st, Minnesotans will have a new set of options for health insurance through MNsure. And MNsure will be a new way for people to select health insurance if they do not already have insurance provided by an employer. And so we want to give all potential Minnesota customers, MNsure customers, the opportunity to do some research in advance of that October 1st rollout so that they're ready to act when they have the chance to act. So in coordination with the information released today by the Commerce Department, the Minnesota Department of Health has posted on our website a preview of the network of clinics, hospitals, and chemical dependency treatment centers that will be available on MNsure. The information will be on a website, www.health.mn.gov/MNsure networks, which will give all of the information that you need. Our site is designed to do one simple thing: give people the preview of the provider networks that will be offered through MNsure. The site contains a list of carriers and healthcare provider networks that will be on MNsure starting October 1st. MDH has approved 15 networks being offered by insurance carriers on MNsure. The list of carriers provided networks include those that Commissioner Rothman had identified. Our site provides computer files on each network displaying hospitals and clinics and chemical health providers, and each file is organized by providers by zip code and alphabetically within those zip codes, so for ease of finding information. Using this information, consumers can preview their options for care and see whether a specific provider or clinic is going to be available to them, and if not, check out what other alternatives might be available to them. There will be lots of options for people, but each person and each family's needs will be different. So it'll be important that anyone looking at MNsure, that they take the time to figure out what will work best for them. And as you might expect, there will be a relationship between cost and options, but that options will actually be very narrow, as was pointed out in terms of cost. Some networks will be skinnier than others, but that doesn't mean that the quality of care will be any less. All of the approved networks have met applicable state and federal requirements as qualified health plans, all providing high-quality services. And as you can see here today, there are a number of important partners working on Minnesota's health reform, on the health reform team. At the Health Department, one of our roles is to make sure that the health plans offered by MNsure meet the required certification standards. MDH also reviews and approves the benefits offered by MNsure HMOs. Commerce reviews and approves the benefits on the non-HMO providers. One of our top priorities going forward is to work with MNsure to make sure that the essential benefits that are provided and that insurance that have networks large enough to ensure patients get the right care when they need it. So in closing, another top priority for us is to make sure that people have the information they need so that they can make the right choices for them. We believe an informed citizen is an empowered citizen, and that it is particularly true with a sometimes complex and personal issue like health care. So we hope that the information that we're sharing today gives Minnesotans the power to be an effective advocate on their own behalf. We know that many Minnesotans are interested in knowing more about these options, and we also know that having access to quality health care is a key element of healthy individuals and healthy communities. So that's why I'm up here as the state doctor. My prescription for potential MNsure customers is check out the information online, find out what's best for you and your family, and then sign up, because we will be a healthier state because of that. So with that, I will turn it over to April Todd Malnov, the Executive Director of MNsure.
So first off, I just also want to reiterate how exciting of a day this is, I think, for Minnesotans. This is truly a day where coverage is going to become much more affordable for over 1 million Minnesotans, and that's a very exciting day, and we're very much looking forward to the open enrollment period starting on October 1st. I also wanted to say a big thank you to our partners that we have at the Departments of Commerce and the Department of Health, and also the carriers as well, for all of the collaborative work and the hard work that has gone into creating more affordable rates for consumers. And I really think that Minnesotans will be very excited in the fall to get coverage that is really much more affordable. So I wanted to talk a little bit about what these rates mean for Minnesota. In addition to the low rates that Commissioner Rothman has explained, many individuals and small businesses through MNsure will get even lower cost coverage through the application of premium tax credits. We are providing a packet with much more detail, also available on our website, and will be available at the end of the press conference, that provides detailed information for geographies across the state, various income groups and age groups, to get an understanding of what the premiums are and what subsidies individuals and small businesses will be eligible for, so you can get an example of really how affordable this coverage will be for Minnesotans. I wanted to highlight one example that's in that packet. In addition to the low rates that a 24-year or 25-year-old will have in one region in Minnesota, with the application of tax credits, that already low premium will be cut in half for that individual. And so that's just one example of we're already bringing in low rates in addition to premium tax credits, really serve to benefit Minnesotans. The tax credits will also equalize prices by income across the state, regardless of age or geography. The tax credits are based on a percentage of income. And so based on that percentage of income, regardless of where you live or what your age may be, your premium will be based on your income. And so it will equalize prices across the state. Another important point that I wanted to reiterate is that it's important to note that these low rates are associated with more comprehensive coverage. The coverage that will be available in 2014 and through MNsure is more comprehensive under the ACA starting in 2014. And the provider networks associated with these plans will be meeting strict state standards for network adequacy, and will also include essential community providers. And most importantly and lastly, one of the things I also wanted to stress is that the creation of MNsure not only brings affordability to Minnesotans, but also allows them the ability to compare apples to apples the plans and the choices that are available to them. For the very first time, they'll be able to see affordable choices, be able to compare the components of those choices, and really pick the plan that is best for them and their families. And so we are very excited to be able to announce these rates today, and very excited for those Minnesotans who will be able to find more affordable coverage through MNsure. Thank you.
Hi, I'm Brian Buettner. I'm chair of the Board of Directors of MNsure, and our mission is to ensure that every Minnesotan has the opportunity to choose, find the health care coverage that fits their needs without consuming a disproportionate share of their income. And what you're seeing here today is just a first step towards it, but a huge step towards it. The consumers who come to MNsure will have quality of choice, both in plan. As April said, it's expanded coverage. It's better than they've seen in the past. The carriers are participating across the state, as Commissioner Rothman pointed out. So every Minnesotan is going to have meaningful choice to be able to find plans that cover prescription drugs, preventive visits, hospitalization, the things that you don't necessarily see today. And as we can see from the great rates that we're seeing in Minnesota, the ability to not only buy what the bare minimum is required by law, but to buy up and to see what will fit best for them. You can come to MNsure. The packet today will give some very good examples across the entire state, across different age ranges, to get a good sense of what that assistance can look like, so that at the end of the day, we deliver on our promise to make it easy for consumers to reach out, find a health plan and a coverage that fits their needs without consuming a disproportionate amount of their income. You've all been very patient. I suppose now is the time to talk to questions for anybody. So I'll step back to you.
That's fine.
What about the small group market?
Yes, good question.
How did those rates stand?
Sure, and I meant to talk about those, so thank you. The small group market, and the small group market, again, are companies with 2 to 50 employees, the small employers in Minnesota. It's in our press packet, have shown, and basically the answer is that the small group market plans that are in MNsure are very competitive with the rates that are in the small group market, the rest of the market outside of the exchange. That the rates are very low, that they're at a price point that I think for all Minnesota businesses will see great options, again, just like in the individual marketplace, be able to choose from different companies, be able to choose for lower price options, and basically, I think the bottom line is it's going to be very competitive rates from MNsure that are sold to the small group plans.
How many companies will be selling small group?
3.
And what are they? And who are they?
They are Blue Cross, Medica, and the third, preferred one? Preferred one.
And they will be available statewide?
Statewide.
Speaking of companies, a few months ago, you guys said there were maybe 9 companies that submitted plans, but we're only hearing about 5 today.
Well, there are 9 companies, and this is how it breaks down. There are 5 companies that are selling on the individual market. So that's those 5. There's 3 that are selling on the small group market for the small businesses, and 1 dental. That's the Delta Dental, yes. So that accounts for the 9.
Another question with regards to numbers. You said more than 400 products were submitted, but then I think it was like 83 and 68
Yeah.
in terms of individual and small groups. What's the discrepancy there? Are we going to see more products disclosed later on?
Well, when we opened our filing on May 24th, companies that wanted to sell on MNsure filed their products with us. The way they're packaged, they also included other products that will be approved for October 1. So those that will be out, not on the exchange, but outside the exchange. So there hasn't been any reduction. We're always 141 on the exchange on May 24th, and for what we're approving today. Again, there's 141. It breaks down 73 in the individual market, or 78 in the individual market, and 63 in the small group market.
Since communities of color have been disproportionately affected by low and high insurance rates or just health disparities, how much was that put into the play in terms of making decisions to make sure things are affordable? Also, what about people who don't have access to the computer? How would they get this information that you claim they can get to so easily?
So let me start off, and then maybe others would also want to comment. But from day one, MNsure, one of the highest priorities for MNsure was to address communities of color and the disparity. In particular, the issue of the uninsured and the price. What this does today, in particular, what we're announcing in terms of at least the rates, is that with these low rates, more Minnesotans will be able to afford coverage at a quality coverage, and then as well, these rates don't include the financial assistance that will be available to them that will bring those rates even further down. So making it more accessible at a lower rate to communities of color, and for particular to try to help resolve the disparity in access to health care. So we believe that on all these points it'll be very helpful, and in addition to all that, delivering quality care, stronger, better competition with strong networks. And I do have to say that the Minnesota Department of Commerce will have all this information available for Minnesotans, and that MNsure itself, as everybody knows, the call center opened this week, that staff at both MNsure and at the Department of Commerce and the Department of Health are available to answer any of the questions, all the details for folks, as well as the Assister program and the Navigator program to help people understand and learn about the great quality of the products here.
Can you do a little bit of a breakdown as far as how many folks the individual market actually will serve at this point, what the estimates are? Because I know it's like Medicaid and Minnesota Care will be taking up a chunk, small group. How many people are we really talking about in the individual market?
Yeah, for that, I mean, part of it'll depend on the take-up, but remember we had the original estimates, and I'll let April speak to that in terms of the total number.
So the projected number, and this is by 2016, projected number for individuals coming through MNsure is about 300,000, and for employees of small businesses about 150,000. We know that it's going to take a few years to ramp up to that, and so those enrollment estimates will be lower starting in 2014.
So for Minnesota Care and Medicaid, that's like around 700,000?
Minnesota Care and Medicaid together is about 880,000, those two groups together.
So this is comparing premiums against other MSAs that have been publicly released. How did premiums in Minnesota in 2014 compare with current Minnesota premiums?
So what we're releasing today is the products for MNsure, just the 141, both on the individual and small group market. The products for the rest of the marketplace are still in the process of review, and those will be announced on October 1. So in terms of a comparison, we're not at a point right now to be able to compare the MNsure products to those that'll be available in the standard marketplace that we've had. But it's our understanding that from a general perspective, that the plans that are available on MNsure will be available outside, and then as well, these are new products, meaning brand new MNsure products with the new metal levels, the new ACA benefit packages, and so there really isn't a comparison, apples to apples, between these products because they didn't exist before and what's in the marketplace right now. Remember, these are 2014 rates and products that will be available starting October 1 for purchase, that will be effective on January 1, 2014. And the rest of the market products for January 1, 2014 are still in the Department of Commerce under review for approval for any product that's outside the market, outside the MNsure market. We can get you that information.
So do you feel that somebody taking out something equivalent to what they have now in the private market is going to pay more or less as of January 1st?
My view and perspective is that, going back to some of these points, is that when you take the lowest priced option of $90 and you're an individual and you have a product now, you can have the opportunity to look at that product and say to yourself, here's what I have now. It has a deductible of X amount of dollars. I can look at that $90 one and I can compare that deductible and say, is that better or not for me? And it'll depend on what people have. Some people have high deductible and low deductible plans. The other factor that comes into play is that at the bronze medal, as you may know, there's 60% is the actuarial value that all of these products have to achieve. That at the silver, it's 70, 80, and 90 for each of the gold and the platinum level. So some of the products in these metal levels have a higher or lower deductible, and there's more choice. So people can take a look at these products and may be able to purchase a better product that fits them depending upon their price point.
So for this $90 plan, if I had the equivalent plan today, would I be paying more or less on January 1st?
We haven't studied the specific comparison because these products, the $90 plan may have a different deductible, and there's a lot of products to compare, and it's just, that would be thousands of comparisons, and we haven't done that.
On the care center, the call center that's just opened up, are there any preliminary information on how it's been, how many people have called in, and how diverse is the staff in terms of dealing with, again, communities of color?
So our call center, as was mentioned, has recently opened. On the first day, we had roughly around 300 calls, I think, as of yesterday. Yesterday, we had 1,500 calls, so it has been increasing over the week. And we have staff at the call center that speak multiple languages. So in addition to English, our call center representatives all on site speak Somali, Hmong, and Spanish, as well as 140 languages are available through our language line.
We talk about the tax credits with you, whoever, April, who gets these tax credits? Who's eligible for them? And how many of this pool of a million people will get them?
There's actually two types of tax credits, so I'll talk about both of those. So there are individual premium tax credits, and those are available to people that make less than 400% of the federal poverty level. And there's a chart in the packet in there that kind of explains what that is. But as an example, for a family of four, that's about $94,000. So as long as that family of four doesn't have access to affordable employer-based coverage, they can access the tax credits to make their coverage more affordable. So that's on the individual side. There are also small employer tax credits that are also only available through MNsure. And small businesses that have 25 or less employees and have an average wage of $50,000 or less for those employees, they are also eligible for tax credits. And that tax credit can be substantial. It can be worth up to 50% of the employer-paid portion of that premium.
So 50% of the premium that they pay that you just outlined here. So
of the employer-paid portion.
Bonds, and you've got an individual in there. How much would the tax credit be?
I should clarify that last statement. When I said 50% of the premium, that's for the the small employer tax credits. So 50% of the employer-paid portion of that premium.
Let's go to the individuals. How much is that, and how many people will take advantage of this?
So how you calculate the individual tax credit really is a compilation of someone's income and where they are in the poverty level, because there's a sliding scale. So there's a calculation on a percent of income as to what a person should pay for insurance, and that's based on a benchmark plan, which is called the second lowest cost silver plan. Based on that, the tax credit is determined, and individuals can take that tax credit and purchase a less expensive plan or a more expensive plan, but that tax credit stays the same way. And so that formula and that process of how that works, we've also laid that out in the packet, and you're able to see how that tax credit applies to all of the four metal levels for all of the different geographies and different ages.
For our viewers, in general, there will be a lot of people taking advantage of this tax credit.
Yes, many individuals will be eligible for the tax credit. We anticipate that well over 50% of the people that use MNsure will be able to access the tax credit.
So there are 9 regions in Minnesota, right? And product offerings and premium will vary across the 9 regions, is that right?
Vary across the 9 regions, but also by county. And maybe the Commissioner talk about that.
So on the chart, you've got the Twin Cities. And I guess I wonder, is the Twin Cities the most expensive, the least expensive, somewhere in the middle? And if it's not most or least, what are the highest? What's the highest price region in the state, and what's the lowest price?
So let me speak to it generally, but then we have all that detailed information, and we can follow up with any more specifics. I think generally what you see, maybe we can get the map. Can we pull the map up here? What you see is that, again, 85% of the counties have 3 or more health carrier companies that are in it. There are 5 companies in this area here. So it's very competitive. Blue Cross Blue Shield Health Partners, for one, Medica, very competitive, and the rates are really strong. Same with the 4 and the 3, and you can see that this competitiveness is in a large swath of the area. Where you have only 2 companies is down here in New Olmsted, Dodge, the county down here.
In Rochester.
Rochester. So that would be the area where there is 2 major companies, Blue Cross Blue Shield and Medica, and those companies are providing those products down there. And so the higher priced products will probably correlate to the prices in that region. But I do have to say that I believe that people can sign up for either of those 2 companies with at least 2 products, and it'll include Mayo.
I was going to ask on that topic, because I know for MSHA patients this is a particular issue. Will the rest of these plans include Mayo as well? I mean, it seems like Mayo would be included because it's in that area, but are we going to see that included in other networks around the state?
I don't have the specific information, but we can get you that. Yeah.
How about more broadly, the big news is lowest rates in the nation. Why? Can you explain to people basically why?
Absolutely. So going back to, I think, which is, you wake up today, I'm able to come to a press conference and deliver good news. And the reason for low prices, good competition, I think goes back to a strong culture of health reform in Minnesota that goes back to the 20, 30 years, where Minnesota has focused on high quality. We have nonprofits in Minnesota. I think if you look at, too, a big factor is the medical loss ratio. Minnesota has had that law on the books for many, many years, which is the rule that companies have to have a certain percentage, a very high percentage of their dollars, every dollar, go toward benefits. Because those reforms have been in Minnesota for a long, long time, and because we have strong companies who I really want to acknowledge stepping forward and providing good products at competitive prices, I think we're able to see that, and the benefits come very clearly in good price, very low prices, with very good competition, with strong health companies, and again, at least 2 to 5 throughout the state, and well over 85% with strong coverage.
Commissioner, I know we're focusing a lot on the price, but there's other levers that affect consumers, such as the deductible, which we haven't talked about, and the skinniness that Commissioner Ellinger mentioned. Can you talk a little bit more about the qualities of the plans? What other characteristics are people going to see?
Sure, and again, we have all the details, and so we will, well, there will be more information that comes out. We're posting it this afternoon, and we can go through it for every single product, what they are with the deductibles and co-insurance and all of that. And it's hard to characterize because in each of the metal levels there are different deductible levels and different co-insurance levels. But what I think is another good story in the detail is that there's variation and availability of different deductibles and price levels. Going back to the other point I made, which is that you can purchase a silver and gold plan in Minnesota for the price of bronze in another state. Again, that goes to being able to purchase better benefits with whichever deductible suits your particular need, a higher or lower one, depending upon the price, to be able to suit your individual or family needs.
But you said something about, I think, 141 plans. How many plans will individuals be able to look at in each region, each county? What's the variation there?
So again, there's 141 plan products, 78 in the individual marketplace, and 68 in the small group marketplace, so for businesses. And we will be able to break that down. I don't have it broken down for me in particular, but again, going back to it, you have 2 companies in every part of the state. Each of them have multiple products, and in those areas where there's 5 or more, and it's the vast majority of the state, you have 5 companies with multiple products in each of the bronze, silver, and gold and platinum
And each
levels.
company has to have a product at each of those levels?
They do not, but we do in Minnesota, which is another great story in Minnesota, is that all of the plans have come forward with products that are competitive in each of those metal levels. There may be one area in the state that that doesn't have that necessary coverage, but it's not. I'll get that for you.
April, I think, had something there on that.
So in addition to the packet that we released today, also what will be going up on our website later is connections to the information that Commissioner Rothman mentioned regarding the details of the plans, the details of the networks that Commissioner Ellinger referenced. In addition, we'll be putting up a chart that shows which plans are available by county. So you'll be able to see that crosswalk as to which plans are available by county.
Today, or
It'll either be going up later today or early tomorrow.
So maybe not today, for our reports tonight?
We are working as fast as we can to get that up.
So roughly half of the people on this will probably qualify for subsidies on the individual market at least. There will be a lot of people who will want to shop this who won't get subsidies but will want to look at competitive prices. Can you tell me if these folks will save money from last year, or if it will be about the same, or if they'll be paying more?
It's we don't have. We can try to get you some of that information to be able to do that. We didn't do that comparison for the press conference today. And again, we go back to the new rates that'll be available on October 1. We want to stress that point. But I do believe, just as a general matter, that because of what we've seen, that most individuals in the individual marketplace will be able to shop for very competitive rate. These are very competitive rates compared to what they have today.
when you say very competitive, you mean lower?
What I mean is that there will be some that there will be low, it'll be lower, much lower, some that'll be about the same, and some where people might choose a different deductible or co-insurance arrangement based on their needs.
I think we're all asking the same thing, equivalent insurance, not if you go with a Cadillac plan in the future, but equivalent insurance. Are you expecting most people to save money?
I believe that most people in the individual marketplace will be able to take a look at that and find a product that is competitive. Many will be it'll be less, and that and again, going back to that question, that's not including the assistance people will get with the MNsure. And when you factor in MNsure, that will bring it way down for a lot of people.
Can you find that out online now, how much the tax credit would be?
I'll let April speak to the MNsure.
So the packet that's available now gives quite a few examples of how that tax credit would apply.
I'm looking at what the average person going online might go.
Yeah, that information will be available on October 1st. So there'll be a calculator on the website there where you'll be able to see that. The information that's in the packet is what will be up now for the next few weeks until that's up. The other thing that I just reiterate is that the coverage that's available starting in 2014 is different than what exists today. So it's very hard to make an apples to apples comparison. You have more comprehensive coverage. You have deductibles that are limited at a certain level, around $6,300 for an individual, cannot go higher than that, which today there are higher deductibles. Also, just the comprehensiveness of networks that needs to be included. The coverage is just very different into the future than exists today. So trying to make an apples to apples comparison is difficult.
We have time for one more.
Well,
One or two. Well, we
this
set it
is
up,
pretty complicated.
we understand, we set up for quarter two, and we just want to try that.
When I was at the booth at your booth at State Fair, people were asking, can I just get comprehensive insurance? Just for the big stuff. Is that available? Or do you have to get a more, I don't know what word is, more complete policy?
So in 2014, for all of the individual in the small group market, individuals will be enrolled in something called an essential health benefit set. It includes 10 categories of benefits that all plans need to include. Really what the meta levels are the level of cost sharing that is associated with those plans. In addition to the 4 plans that we've talked about today, which is the bronze, silver, gold, and platinum, there's also a catastrophic level plan, which is roughly a 50% actuarial value plan. But there is limitations as to who can enroll in those products under the federal law. It includes those that are under the age of 30 and those that can't find an affordable plan less than 8% of their income. So that is limited starting in 2014.
Can I ask one group about small group? So 3 companies, that's a lot less than the current small group market, right?
Well, it's 3 companies who have chosen to sell products on the exchange.
Right.
Yeah.
So, I mean, are you all disappointed? I wonder, are you lowering your projection for how many small group folks are going to come into the exchange? Because, right, how many companies are in the traditional small group market? It's a lot more than 3.
So I have to just to just tell you my own feeling is that I didn't have any preconceived conceptions about what to expect when we got the rates filed. And both in the individual and the small group market, I'm very pleased with the companies that have done so. I believe that there will be better options. I think the MNsure has through these products that will come out for the small group market provided another outlet for competition for Minnesota, and I think overall this is, again, remember, the first year. And as it goes forward, I think on the small group marketplace, we'll probably see what happens, but I can't speak to that.
Thanks, everybody. They'll be available for questions afterwards. We're going to wrap it.
Thank you, everybody.
I'll make people want into this.